morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Thursday, September 17th.
It
week
is.
number 27.
Did we say 27 or 28?
I think we're still 27.
27, okay.
I think we're 27.
Okay.
Don't rush the year.
Well, I think everybody
Even though we
is
would like it
interested
to maybe,
in rushing the year.
2020 has been a year.
It's been a year.
Yes. So there's that.
Yeah.
But anyway, we're glad that you are with us, everybody, because we have I would say this is a packed show today.
It is.
You know, we said that before, but this
And
week
it has been.
I really think it's a packed show.
It is.
We have no less than 4 guests coming on the program today. It's a visual.
Yes.
Right?
For our radio listeners, we both just stuck up 4 fingers to check each other's vision this morning.
Exactly. So there you go. We know our numbers.
Yeah.
So,
you can trust
one
us.
of our guests is already on the line.
Good. Let's go to her.
How about that?
Go to the phones.
Go to the phones. Good morning. You're on KSJE. This is Andrea Pena from the Childhaven Foundation, an organization near and dear to both of our hearts, I know. Andrea, good morning.
Good morning, Scott and Megan. Thank you so much for having me on today.
Thank you for calling in. It's great to talk to you and hear from you. And what's going on with the foundation this week?
You know, we have been, we've been operational through all of the COVID pandemic, and I wanted to call in today specifically about a couple of Childhaven's programs that we really just want to make sure people are aware of. Our mission is lifting children from crisis to hope, and we recognize that there are some kids in situations right now that are just unique, including mental and behavioral health issues. And I just wanted to come on today to remind families and parents that we have a resource for them, and we are here for their families. And I just want to share the word about that.
Great, and thank you for doing that, because we hear a lot about how families and kids and even moms and dads and adults are having difficult times during this pandemic, whether they're staying at home, they're trying to go to school from home now, and all the frustrations and challenges that go along with all these things that families are dealing with. So I appreciate you calling in to remind us of those services at Childhaven.
Yes, and thank you again for the opportunity. And I also wanted to mention our free parent education program. Again, these are unprecedented times, and homes are having to be managed differently, and we want to help. We're here to help. It's free to the community. And so, if a family is facing struggles, we just want to make sure they know that we are here for them and we are here to support them.
Terrific. And Andrea, how can folks maybe find out more information or maybe call you if they have additional questions on how to sign up for some of these things?
Yes, please go to our website, Childhaven NM. So that looks like Childhaven, New Mexico, childhavennm.org. The number to call is 325-5358, extension 130. That number is also seen on our website.
Great. And I have a question about donating. Of course, it's kind of a weird time, maybe we feel like, to ask folks for donations because we are in trying economic times, but also for those who can give, and we know that the work there never stops. And so how would I donate to the foundation? And also, what makes the foundation maybe different than other forms of donating, if that makes sense? Sometimes we need some foundation education.
Yes, thank you so much for that question, Megan. So the foundation is really important because it ensures security to each of Childhaven's programs. And so when we are looking at the overall cost of Childhaven and making sure that the children in our community and throughout the surrounding areas, we serve children not only from San Juan County, but also McKinley County and different parts of the state. So to make sure that they have those resources available to them, there has to be financial security. So the money raised through the foundation, like I said already, ensures that those programs can happen now and for years to come.
Great. Well, thank you so much for calling in. We have 4 guests, but we wanted to get all the good stuff packing in the beginning of the show. So, as always, pleasure to talk to you. I know that you also are a friend of the show here. Love KSJE, right?
Yes, absolutely. And the work that you guys have done to inform the community during this time is just awesome. So thank you for what you guys do and the time you put into this. It's really important.
Well, thank you, Andrea. We appreciate that, and we're here for the community just like you. So thank you for being a part of the program today.
Awesome. Well, you all have a great rest of your day.
You too.
All right, you too. Thank you. That's Andrea Pena from the Childhaven Foundation. And you wrote down that phone number.
I did.
So once again, if folks are just joining us.
Yes. So the phone number is 325-5358, extension 130. So 325-5358, extension 130. And
there you go.
Yeah.
That's the Childhaven Foundation.
That's right. And we're both fans of Childhaven.
Definitely.
They do a lot of good work, and they fill a really significant need for a vulnerable population. So.
They definitely do. And it's something that we really need to keep in mind during these times, as I've said. And as Andrea said, there's a lot of folks who may be struggling, and we really need to make sure that they understand we have resources in town.
Right. For families and parents as well, not just displaced children. So that's always an important point to push.
Exactly. So we also want to share with you some of the other testing dates and times that are happening this week here in San Juan County. Again, here at San Juan College this evening, Thursday, September 17th from 6 p.m. to 7 p.m. Again, tomorrow, Friday, September 18th here at San Juan College in the morning. I think that's the only morning testing time from the health department this week from 7 a.m. to 8 a.m. here at the college. Tomorrow, exactly. And again, you can register online before you get there. You can call the health department if you need help getting registered. The number is 505-327-4461. 327-4461. They can get you all set and ready to go. And again, I believe it was Scientific American that called out New Mexico's testing numbers, that every resident citizen who wanted a test could get a test, and they called that really outstanding.
Good.
When it comes to coronavirus response. So
yes. Do you subscribe to them?
I do not subscribe to Scientific American.
I used to subscribe to Scientific American.
I certainly appreciated their shout-out, their positive shout-out for our state.
It's a good publication. It's a legit publication.
Oh, well,
yes.
I would only subscribe to a legit publication.
That's right. Like, we don't see a lot of astrology and stuff coming out of Scientific American.
No.
That's a different
magazine.
Yes, that's a totally different magazine.
I would say. That's true. All right. So let's talk about some other numbers as well. I know your favorite, Johns Hopkins.
It is my favorite.
Have been tracking this since the very, very beginnings.
That's right.
And so where are we now?
We are at total confirmed U.S. cases, 6,635,467, and total confirmed deaths, 196,912.
Okay. There we are.
Whew.
It's a lot of people.
It's a lot of people. It's hard. Like, I think a while back we reached a number where it's hard for our brains to conceptualize that. Sometimes it's easier to think about how many individuals that is, and then at some point you just reach sort of the max capacity. And so, anyway, so I just encourage reading about personal stories can really help keep us empathetic and not jade it to this horrible thing going on.
That's true. Well, right, and the numbers sometimes just kind of come at us so fast and furious, and we're going to share some more in just a moment.
Yes.
But it's sometimes hard to just remember that each one of these numbers represents a life lost, or someone dealing with sickness or illness or family, all those things. So that's my point this morning. Here are the state numbers. Again, we had 119 new cases yesterday, topping 27,000 in New Mexico. 10 additional cases in San Juan County, but I think it's important to point out earlier this week there were several days in a row we had 0 new cases in San Juan County, which I think was a great accomplishment. So great news there. 2 additional deaths in the state yesterday. None of those were in San Juan County, and we had 200 more, almost 208 more recoveries, for now a total of 14,842 recoveries.
Yes.
In the state, which is great.
Which is great.
So we always like to see that. And then the other numbers here, again, the daily statistics from New Mexico and on the Navajo Nation, they're now at above 10,000 cases, with 18 more reported yesterday and 2 additional deaths. And they have 7,190 recoveries from COVID-19. So that's good news on the reservation.
That is good news.
As well. So there you go.
Cool.
So shall we go to our next guests?
We should.
All right, our doctors.
We love the docs.
We do indeed. Let me find their. We talked to them yesterday, so this is a pre-recorded interview, but we certainly appreciate them talking to us. And let me see where they are.
Paging
doctors.
Dr. Philpott and
They're
Dr.
here.
Greenberg.
They're here. I just need to find them
on our own equipment. Again, short-staffed, and by short staff I mean we run it on,
exactly.
me, you, one other.
That's it.
That's it.
That's about it. That's here. So it's me looking for their interview, which I found. I just need to get it played. So here we go, everybody.
Good.
This is Dr. Aaron Philpott, Dr. Brad Greenberg, again from San Juan Regional Medical Center. We always appreciate their, that's interesting.
Technical
That's
difficulties
left
happening
again,
this
right?
morning.
I know. Anyway, we always appreciate them calling in. Their time is so valuable, yet they set aside time to talk with us, every other week or so. So we appreciate that.
Yes.
So here they are, everybody. Stand by.
Joining us now here is Dr. Aaron Philpott and Dr. Brad Greenberg from San Juan Regional Medical Center. Good morning, doctors.
Good morning.
Great to have you with us again. So I want to kick this off with questions about vaccines. We have a lot of new reports coming out about vaccines being maybe 50% effective, and so I know that that's a little irksome from some folks. It sounds like you could just flip a coin in a crowd of 100 and maybe 50 will be actually vaccinated successfully, and so I just want to hear you guys' update on that.
Yeah, I'll take that one. This is Dr. Philpott. So the FDA requires for approval in the United States that the coronavirus vaccines are at least 50% effective at minimum. So I think, obviously the more effective the vaccine, the better. But I think looking at flu vaccines and how they're matched each season, they're not always a great match, but they still provide an incredible effect on mortality related to flu, hospitalizations related to flu, and overall severity of illness related to flu. So I think even if the vaccines just are attenuating illness or preventing hospitalizations or preventing some of these long-term coronavirus effects, that they could be very efficacious. But, obviously the more effective, the better.
Right. And so let's actually broach people's fears. There's also been some polls taken about how comfortable Americans would feel if the vaccine came out, receiving the vaccine. Can we speak more to that?
Well,
sure.
would it be okay to comment? Oh, I'm sorry.
Yeah.
Would it be okay to comment on or further expand on the sort of the overview of the vaccine?
Yes.
Because right now there's a boatload of vaccines, and even though there's some concern that one vaccine may not necessarily be as effective, we're still in the trial phases here, where really we're trying to understand and make sure that the vaccines are safe and effective. And this is not this is a one-shot deal here, no pun intended. This is 40 vaccines are currently in clinical trials in people. And there's 92 additional preclinical vaccines that are basically working with animals. And, there's these, tier after tier of these what we call phases with the normal FDA approvals, and all of these different vaccines are in different phases. But I think one thing that's very important is that not every vaccine has the same approach. And so just because one vaccine isn't turning out to be as promising as we hoped, there's a whole range of other approaches to the actual pieces of the virus that we're trying to generate an immune response for. Because there's genetic vaccines, there's protein-based vaccines, there's also viral vector based vaccines, which are related to how the viruses get into cells. And there's really company after company working on this particular problem. And even when we look at decisions that I think are happening outside the United States, the biggest one that we sort of wonder and what the decision making was what happened in Russia, for example. And even there's published research now which basically looks at even what we would consider phase 1 or safety-based testing and phase 1 and phase 2 testing for that vaccine in Russia. It looks like there aren't really any adverse events. But there is simultaneous work happening with dozens of vaccines around the world, and it really is kind of a race to see who can make a vaccine which is going to be safe and effective, and then figure out how to distribute the vaccine, which is a total different real challenge from a population health perspective. So I think the most important thing here is that we don't have all of our eggs in one basket, so to speak. And just because we're hearing news that we may not necessarily like to hear, I hope everyone can feel confident that there is a worldwide effort to try to solve this and to try to do this in a meaningful way, which is going to have a lasting and a meaningful impact.
That's a good point, Dr. Greenberg. Thank you. And I wanted to ask you both as well about this work on these vaccines when we see multiple vaccines and trials going on at the same time from different companies or maybe competing companies or countries. All this work is going so fast. I mean, really, from the development of other vaccines, this is really at a breakneck speed. Can the public be assured that all the vaccines that do get released to the public are going to be safe or effective? I guess that's what these trials are all about, right? That's why they do this.
Yeah, that's exactly right, Scott. I think the Sputnik 5, which is the Russian vaccine, there is a little bit, the world's looking that way to see what's going on and what's going to happen. It was released before the phase 3 trial, I believe the phase 3 trial where they look for safety and efficacy in large populations of people, pulling in different groups of people, including older folks, pregnant people, and broadening sort of the group a little bit. So I think, in our country, the FDA, it's important to know that these different bodies, scientific bodies, or the FDA governing bodies, are hopefully separate from politics and have put these structures in place to ensure that this is a rigorous process. The phase 1 and phase 2 trials have most certainly been complete without cutting corners, but very quickly due to the need for this. And then it will be really important to see the results from those phase 3 trials before the vaccine is released to the public. So I think the structure is there, and if carried out, the public can be reassured that the vaccine safety is there. And I know Megan was referring maybe to the Gallup poll where I think it was 1 in 3 Americans said they probably would not get the vaccine at this point in time. There's a large population of anti-vaxxers in the United States, or people who have overall distrust or mistrust in vaccines and how they're administered. But again, it's a big process. There are sometimes adverse effects of vaccines in large populations of people. And I think, it's a different way for Americans to think about focusing on public health and protecting each other at the risk of even if it's a very low risk of a possible adverse event for themselves personally. But I think that the measures, the safety measures are in place, and hopefully the different companies will carry them out, and our FDA and government and everyone alike will come through for us and provide a safe and effective vaccine, or multiple vaccines, hopefully.
Right, thank you. And that's a good point. And I wanted to ask you one final question about vaccines, at least from me, that as these start to get rolled out, I think folks are starting now to think about that whole process, right? How do you get a vaccine out to 300 million people in one country, or things like that? Would they roll out? I guess the only thing we have to compare it to maybe is like a flu shot, like a flu vaccine, when we try to inoculate the entire population in this country. Is that how you think they could do this?
So I think that, so great question, Scott, and I think that one thing that I hope that folks can be reassured with is that this is not the first time that we've tried to think about how to distribute large amounts of either antidote or vaccine to populations. There's large-scale federal efforts to basically develop what are called pods, or points of distribution. And their whole community programs, one of them, the bigger ones, was called the Community Readiness Initiative. And that was essentially an effort to try to figure out how to deal with either a chemical or a biological event, or the need to distribute basically antidote, antibiotics, or vaccination. And so right now there's currently work trying to adapt some of these models for large-scale vaccination processes. And lots of places around the country are trying to use flu vaccine, which I think is very important for everyone to get, but using flu vaccine and flu vaccination is almost like a dry run for how they're going to do things with the novel COVID vaccine. And so I think there's lots of work around this, but the challenge is real. Some people have described this moonshot idea of trying to make a vaccine for COVID in such a short time frame is mirrored only in complexity by the desire to vaccinate 350 million people, or you could say a good proportion of 7 billion people in a short time frame. So I think that there's definitely lots of complexity to it, but it's one of those things that there's a lot of work right now, forward-thinking work right now, to try to identify how to do so and be effective.
Sure, that makes sense. And so switching gears here, and we already had me rant on Monday about frat parties, so we're going to set aside how young people are.
How could we forget?
How could we forget? You guys might want to go back and roll the tapes on that. But we do have an increase in cases in young people, and so I'm wondering, with that, if we have an increase in knowledge yet about how the virus might be impacting young people. Are there lasting effects that we're seeing there? Maybe Dr. Philpott, you could speak to that.
Sure. Yeah, Scott and I had kind of touched on that a couple of weeks ago. We are having increasing data come out about these long-term effects associated with COVID, even in those who have mild or moderate illness and never land in the hospital. Some of the effects there include damage to the heart or inflammation of the heart muscle. There's been it's sports physical time, and this is certainly not my field of expertise being an adult doctor, but a lot of the younger population is going and getting sports physicals to get approved for participation, and they're looking at the different effects of COVID and are actually finding on cardiac MRIs that there is some residual damage demonstrating that there is this viral myocarditis that's taking place. So that's pretty concerning. I know there's some professional athletes as well who have had this take place, who have been, infected with COVID and recovered, and then are seeing sort of the long-term ramifications of cardiac involvement. There's also long-term or people with protracted shortness of breath and just generalized fatigue, kind of abnormal heart rhythms going up to really fast heart rates. And, yet to be elucidated exactly the cause and the etiology of some of these signs and symptoms after COVID, but most certainly there and concerning, because we don't know how this impact on the lungs might predispose you even to a more severe influenza or pneumonia in the future, which could be, obviously even more concerning for our respiratory season coming up. There's long-term neurologic effects as well, and we kind of talked about that a little bit, people with prolonged delirium and just kind of this foggy brain, and then some other kind of autoimmune features going on as well. Anything else to add to that, Dr. Greenberg?
I think as we begin to understand just the nature of the impact across populations, and we really have to acknowledge that the virus doesn't affect every individual in the same way. But we're a long way from really understanding why that's the case, and we're still pretty far away from understanding how the COVID-19 syndrome affects different areas of the body in different ways. And so I think what is very important for everyone to understand is that there's a lot of value in not getting sick in the first place. Medicine will catch up with this, but it's going to take quite a while to really understand. But right now, the things that exist in every person's armamentarium are social distancing, wearing a mask, and really exercising really good judgment to make sure that they're and engaging in COVID-safe practices. And avoiding getting sick is definitely what I think is the best practice right now, because it's not just the elderly or the infirm that can suffer consequences from this illness. And so I think that it's important for everyone to understand that and stay the course, stay the course, stay, aware of what's going on, use the appropriate personal protective equipment, and we'll do our best within medicine to do the right kind of science to understand why and to develop meaningful diagnostic and therapeutic approaches.
It's a really good point and a good reminder, Dr. Greenberg. Thank you. And I wanted to ask both of you, I know I said we were done with vaccine questions, but one more came to mind because it was announced recently that the Navajo Nation was going to have some of its population take part in some of these trials, clinical trials for a vaccine or a series of vaccines or what have you. From your perspective, and both of you please answer this question, is this a good thing maybe for our neighbors to be part of this? Could this help get things into the population faster and maybe help? Of course, we've seen the numbers on the reservation that were so high at the very beginning of this pandemic, and now they've kind of calmed down, of which we're all very grateful. But what about having these trials so close to home?
I can start with that one. Yeah, I think, the participation of minority populations in these trials is very important because they're often underrepresented. And as we saw through our initial surge with the Navajo Nation so highly impacted with so many cases and so many deaths, the severity of illness, the rates of hospitalization were significantly higher among the Navajo population. I believe the death rate was 23 times in Navajos above Caucasians. And then I think the hospitalization rate was 763 to 100,000 compared to 21 per 100,000 of Navajos versus Caucasians, or that might have been Native Americans more generally rather than Navajos. But regardless, I think it's clear that this is really impacting different racial, ethnic backgrounds differently. So I do think it's important that they're represented in these different clinical trials. I think we have a long history of, minority distrust of the medical establishment for good reasons. And I think that's often reflected in the choice to participate, like flu vaccine rates are quite a bit lower among minority populations, probably driven by a number of different factors. So I think it's really important to be thoughtful and ethical in how all these trials are conducted, but most certainly to involve minority populations so they can understand that they have the same safety and efficacy as all populations when looking at the data.
Dr. Greenberg, do you have anything to add?
I just think that, like Dr. Philpott was saying, it's important as we move forward to address some either vulnerable populations or underrepresented populations to assure safety and efficacy. Another big group that is often neglected, especially during the initial time frame for vaccine trials, is children. And so we need to make sure that we do appropriate testing to assure safety and efficacy in all of these subpopulations. And I think it's really important that we are conscious of the decisions to include underrepresented groups as we move forward.
Well, thank you. That is super important to hear about underrepresented populations. And as always, doctors, it's a pleasure to get to speak with you all. We know that you're busy over there on the front lines, of course. And so thanks for calling in again.
Thank you. We appreciate it.
Thank you.
Thank you both very much. Thank you. Dr. Greenberg and Dr. Philpott, our guests here. And there they go.
And there they go.
And here we're back. Our pre-recorded interview.
Yes.
But anyway, we got out of that just about as good as we got into that interview. Technical issues, but
you sounded like you were like far away.
I think I was running back into the booth or something. I don't know where I was.
They're done.
Yeah,
okay.
That's right. Anyway, but good information from the doctors. We appreciate, again, as I said, always that we're calling in and spending some of their time with us because it's so very valuable. We know they're very busy.
Of course.
At the hospital, so.
Of course,
anyways.
Even though on occasion you've accused them of eating bonbons.
That was early on, yeah. It wasn't them specifically.
No, I know.
Thank you for bringing that back up.
Sorry.
It's okay.
You bring some of my faux pas to the forefront on occasion.
Really? Do I? Like what? Like what? Do tell.
Goalpost. That was
Goalpost.
Goalpost was a famous one.
Yes.
As was Nexus. That was another famous
that's right.
one.
That's true.
Those two stand out to me.
Well, those faux pas have been scarce recently, so there you go. There you go. Let's go to the phones
I
for
think
our
Ginger's
next
waiting,
guest,
so
because Ginger Palmer from the San Juan Medical Foundation is waiting to talk to us. She's still on the line. Ginger, good morning.
I am, but I'm enjoying listening to you two go back and forth.
Thank you.
Morning.
Morning.
Good to have you on with us, and thank you, of course, with the San Juan Medical Foundation. We wanted to talk to you about a couple of things this morning, Ginger Palmer, and one is the San Juan Medical Foundation, of course, helps with the Connolly Hospitality House, but during COVID-19, the facility has changed in its mission a little bit. So can you talk to us a little bit about how things are going with the Connolly Hospitality House and how it's being used today?
Sure. First of all, let me give you a little bit of background on the Connolly Hospitality House, since some people may not know what it actually is. But it's an 8-bedroom facility here on our property, just across the street from the hospital, and it's similar to a Ronald McDonald House. So, except that we don't accept children. You know, we have all adult patients who stay with us. They're cancer patients and their caregiver who have to travel 45 miles or more to receive cancer treatment at San Juan Regional Medical Center. And, you know, we let them stay free of charge. We have food in the pantry for them to eat. We have a fully stocked kitchen, laundry facility, and all the comforts of home. So, you know, typically that's what our Connolly Hospitality House is all about and what we use it for, you know, to just take some of the financial stress of trying to have stay at a hotel while they're going through cancer treatment. You know, it really does relieve a lot of stress off of our patients. But at the end of March, we had to close the Connolly Hospitality House to the patients due to COVID. You know, most cancer patients have compromised immune systems, and so we just felt it was too risky to take the chance of having, you know, patients maybe expose, or their caregivers maybe expose each other while they're staying at the Connolly Hospitality House. And so we made the decision to stop accepting patients while COVID's going on. We are using the facility for other purposes now. We have critical care healthcare workers that are staying with us at the Connolly Hospitality House. So that includes like traveling nurses who are here, you know, working on the COVID floor. We have EMTs, you know, who go out on calls all the time and, you know, are exposed to COVID patients. We have local nurses who have family here that at home, and they might have underlying health conditions, and so they don't want to go home every night and maybe expose their loved ones, you know, to COVID. So we're utilizing the house with healthcare workers right now, and it's been a huge help to them.
That's terrific, and a great way to repurpose that facility. So, and I'm sure it's still getting a lot of use because of the need as you just described.
Exactly. And, you know, we've had, you know, most of the rooms full for, you know, weeks on end. We have days where there's just 2 or 3 people staying there. But, you know, it's just nice for them to know that they've got this place that they can stay, do their laundry, you know, keep their family safe, you know, from being exposed to COVID. We do have a small RV park just across the street from the from our San Juan Medical Foundation office. It's got 3 spaces, so we still allow patients to bring their RVs and stay there. That way they're protected in their own, you know, in their own property, in their own space, and they're not exposed to anyone else. So
that makes a lot of sense. That's a really, I think that's a really clever way to get around the issue. Yeah. So congrats on the creative thinking there.
Well, thank you.
Yeah. Switching gears a bit, I know that every year there's a cancer walkathon, which is usually very, very successful and very important. Obviously, most of us have been touched by that illness in some way or another. And so tell us what you're doing this year for that.
Well, we're having our cancer walkathon, but we are doing it a little differently. This year is our 40th annual cancer walkathon, so we were really geared up and hoping that we could have a big celebration, you know, for our 40th annual cancer walkathon. But unfortunately, due to COVID, like everything else, it had to change. So we are now having our walkathon virtually. So people can still go online. It's scheduled for this weekend, but we are allowing people to walk anytime that they want to walk, anywhere they want to walk. If they want to go hiking up in the mountains, if they want to, take a walk through Berg Park like we normally do, wherever they want to walk is fine. We're just asking them to walk 5 miles and raise $50 for the Cancer Walkathon, which benefits the Connolly Hospitality House and the San Juan Medical Foundation. So if they raise $50, they get a free commemorative T-shirt for the 40th annual walk, and we have those here at the office now. If people want to come by, if they've raised their $50, if they want to come by and pick up their shirts, they're here. Scott came and got his yesterday. So
That's right. There you go.
you can start wearing yours and showing it off to the community for us.
Exactly.
That's
Here it
perfect,
comes
because
now.
here it comes now. I just tossed it over there, so we'll
See there,
we'll
everybody?
show it. There we go.
This is it. The 40th annual.
Yeah.
There it is.
Thank you, guys.
And we appreciate
Yeah.
that, and we appreciate, of course, all the sponsors on the back. So a little shout out to them, including KSJE. Thank you
Including
for putting
us.
us on there,
Yes.
Ginger.
I was
Exactly.
getting ready to say thank you for your sponsorship. We were happy to be able to include your
You
logo
bet.
on the back of our shirt.
But we see Marion Family Foundation, of course, Peak Production, and Virotech are some of your big ones, right?
Yes, exactly. We are truly blessed this year with our sponsors that came through for us, and helped us raise the money that we typically raise. So
Right.
we also have another little drawing that if anybody raises $240 or more, we're putting their names in a drawing, and they'll be entered to win one of 3 tablets. We have 2 Samsung tablets and 1 Amazon Fire tablet that was donated to us by ImageNet, and so we're giving those away to 3 lucky winners of people who raised $240 or more for our foundation.
Terrific. Well, that's great. Well, Ginger, good luck with everything. Of course, as you said, the virtual Cancer Walkathon is happening this weekend, but it really can happen anytime. But I know it's kind of scheduled for Saturday, right?
Right, and there won't be any marked route this
Yes.
year. We just encourage people to either walk individually or walk in small groups, either with family or friends. But next year we've got next year to look forward to, and we'll celebrate next year for sure.
Most definitely. A lot of things we're going to celebrate next year, I think. So
I
this is one more on the list.
Yeah, we'll all gather and give hugs and high fives at the finish line. 41 is still a huge accomplishment. We can, how often do we get to celebrate odd numbers?
That's right.
We never hear about a 41 celebration.
Exactly.
And Monica Nagahiro was telling me yesterday that in the Chinese culture, odd-numbered years are luckier than even-numbered years. So
Well, we sure hope so.
we'll have 41.
Yeah, there you go. I like that.
I like it.
Wonderful. Well, Ginger, thank you so much for calling in this morning.
Yes, thank you.
Well, thank you for having me. I really appreciate the opportunity to visit with you two.
You bet. It's great to talk to you as always. So thank you very much. That's Ginger Palmer from the San Juan Medical Foundation, our guest here on KSJE. And again, the great change of purpose for the Connolly House, and still helping in the community, and the Medical Foundation still doing what it can to help cancer patients and hospital staff.
Yes, yeah. I mean, I've been amazed this entire time when you're thinking about, man, what are some ways to have gratitude during this season that we're all in? And it's like, I love the ingenuity and the creativity and how clever everybody is being to try to keep their important missions moving forward. So
Right. Well, and to keep doing what they can do, even if they can't do what they usually do, there's still some purpose, still some ways that they can contribute.
Absolutely.
Which is great. And
Absolutely.
I think we can all look for things for our own lives, too, to do
yes.
that. So there you go.
There you go. Cool.
But-
well, packed show.
Right? Wasn't it?
It was.
I mean, lots
We
of
enjoyed it. I hope
information.
you guys enjoyed it.
Yeah, we sure did. We did. And thank you guys for joining us for the program. Of course, we invite you to share it with your networks and circles of friends and family to spread the word, spread the local information. That's why we're here.
That's why we're here.
So we'll be back on Monday, by the way, with more local information, because it never stops. There's always stuff to
There's
talk
always
about.
local information.
Yeah.
Rolling through.
There's always stuff to
and
talk
it'll be
about.
week 28 next week.
Oh, my goodness. Okay. There you go. Week 28. Wow. All right. Well, thanks, everyone. Stay safe, stay well, and we'll be back on Monday at 9 o'clock right here on KSJE, online, on the air. Have a great weekend.